hi, it's time to get up and go get some stuff done. But I just wanted to, I guess, get used to seeing you, getting used to seeing me like this. Hair will come back. When I'm walking around without hair, people know that I'm in the fight of my life.
Maria came to me with a diagnosis of lymphoma. Occasionally, lymphoma develops outside the lymph nodes, called extranodal lymphoma. And the GI tract is the most common place where that disease develops. Very few people have this. Only a couple of percentage of the lymphoma cases involved in the extranodal setting. So it's quite rare. Left untreated, lymphoma of any type is a fatal disease.
When we get into the realm of rare tumors, the team had to really work together to really optimize chemotherapy and radiation therapy together to give her the best chance for cure.
Tenemos que darnos ánimo.
You hanging in there?
I am. It's overwhelming.
And I tell them that, hey, we're here for you. It's what we do for a living. I'm here to serve them and get them through a really tough time, and I take that very seriously. We'll get you through it, all right?
Mm-hmm.
Okay. We'll see you later.
Here we really have a community. We have a medical community that's taking care of the whole patient, the family.
For someone that's sick and not feeling well, you're not focused on things because your mind's thinking, oh, I've got cancer. It's just nice to know everything's in one place. The first thing you see when you walk in the room is a garden instead of this big, scary piece of machinery that's huge. It's really a great place to feel like you're at home.
One of the nice things about the treatment that we were able to do with Maria is use something called intensity modulated radiation therapy, which allowed us to really wrap the dose around the area that we wanted to treat and spare a lot of the surrounding tissues. The accuracy there is 0.5 to 0.7 millimeters. It's really, really tight.
How are you feeling?
We turned the footprint of the machine around so it's behind the patient. As one of the construction workers once said, it's behind you to serve you.
You're all set for treatment. If you need us for anything, just call out. We can see and hear you the whole time. Are you comfortable?
There's a lot of elements that go into having a patient feel comfortable. One of the key elements is to make sure that the patient feels seen and feels heard, because if they just feel like they're a number that's being pushed through some machinery, that's going to be their experience.
It's making them feel like we have the time for them all the time. If I can make them smile every day they're here, whether it be 10 treatments or 9 weeks, then that's my job. My job is to empathize and make them smile.
Everything's going okay for you?
Yeah, we're almost done.
We are almost done. Cancer can take whatever it is you give it, but there are lots of things that it can't take, like your dignity or your sense of humanness. And so we really want to really support and honor that part of a person that cancer can never take away.
We deliver the radiation to kill the cancer, but your mindset is part of what heals you so quickly. You okay?
I'm good. I'm
Yeah.
really good. Thank you.
It's essential to keep that positive mindset.
I'd ride an elevator with the bald man and I'd tell him great haircut. And he would just look at me and say, yeah. I wore the baldness with honor. It was like my badge. You know how when you're a warrior that you're holding your badge when you're going into a fight. It was my badge of honor so people could see what I was going through and that I wasn't afraid of it.
She also had a follow-up PET CT scan that showed no evidence of disease. And then over time, if we maintain that remission, then we consider this disease cured.
Beautiful. Hi, ladies. I am a lymphoma survivor from 2.5 years ago, and I took the makeup class because meeting other women that were in the same position that I was in really just made me feel that I wasn't alone.
Our Look Good, Feel Better class helps with makeup when women have lost eyelashes and eyebrows or hair. Also helps with wigs and tying scarves and things like that. It really is helping them to feel like if I walk out in the community, people aren't going to be looking at me like I have cancer. I'm going to feel normal. I can forget about it for a few minutes while I go to the grocery store. They're not going to say, oh, you look great considering what you're going through. You know, those kinds of things are hard to hear.
The hair went, and then pretty soon you don't feel like much of anything.
Just let it go.
Yes.
Don't hold it in. You don't want that in you. Let it out.
These women are feeling hopeless. SHARP and American Cancer Society are here to help these women regain their identity.
Oh, you look nice. We need to go dancing after this.
You can start.
I could see their transformation, and it was just neat. Their faces just sparkled. You look adorable.
Yes.
I'm leaving here feeling like I'm gonna be okay. It's wonderful.
I've seen a lot of patients transform through this process, and they come out a lot stronger in the end. It can draw out that strength of the human spirit that they otherwise wouldn't know was there.
There's just all kinds of great things in store for me. There's a lot of life after cancer. There's a lot of life during cancer. To me, this whole thing was a blessing. I took a lot more out of it than what it took out of me.